My name is Sophia Lal. I had a knee injury in 1993 and had to have ACL reconstruction at the end of 93. My knee really did well for a good 10 years plus. In 2004, I started competing in triathlon. And within a couple of years, my right knee really started getting cranky. I tried to do a lot of things for it, including improve my technique and form as a triathlete. I also started getting viscosupplementation injections, and I tried several of them, including Synvisc, Suparts, Orthovisc, Uflexa. None of them really seemed to last more than about a year. So a year was actually pretty good, and I kept competing as a triathlete. In the last 2 years, it started getting worse. I tried some further procedures, including PRP, injected to the knee joint, and bone marrow aspirate, also injected to the knee joint. They helped temporarily. One other thing that I did, I have very large, extensive Baker cyst on the back of my right knee, and I've had that cyst drained a couple of times, also with very short-lived relief. I felt from the moment I walked into the office that I was really in a very professional environment. It was clean, it was calming. I was coming in for a potential procedure with some possible apprehension and anxiety, and I felt like those fears were quickly diminished by the way every single staff member that interacted with me did. And when I sat down with Dr. Desai, I felt the same. He was very respectful, he listened very carefully, and he made sure that he addressed every one of my concerns, and he also quite thoroughly answered all of my questions. This was a procedure that potentially I'd never had done before. Even though it was PRP, he explained he was going to do it a little bit differently, and I really appreciate the thoroughness. I really appreciated Dr. Desai's bedside manner, I have to say, first and foremost. He was very cordial, he was very professional, and I felt like he really was listening to me when I was answering questions. I didn't feel that there was any distraction in the room, and he was not distracted from taking care of my knee. I explained in detail the issues I was having from a biomechanics standpoint and the type of pain that increased activity created. And he discussed different scenarios with me and how we could help my knee. And then he also very clearly delineated how he would be able to help me. What he offered me was PRP injections. Interestingly, he described his injections that would be done the way I've had them done before, which would be in the joint. But then he was also, with the help of musculoskeletal ultrasound, going to investigate my entire knee and see if there were any other parts of the anatomy that might benefit from PRP injections.